You have heard of the phrase retinoschisis, and people are freaking out about this because the phrase sounds scary, right? I actually went online to surf the phrase on YouTube and Bilibili, hoping to find a video talking about retinoschisis, and guess what? I didn't find any. That's how uninformed the general public is. Unfortunately, we are all terrified of the unknown. If something is unfamiliar to us, we are afraid of it. But as always, I'm always here for you. So in today's video, we'll break down what retinoschisis is, how is it diagnosed, what are its symptoms, who are more likely to have the disease, and most importantly, the treatment options for retinoschisis. That's today's video. Let's get into it. Hi everyone, welcome to my new video. My name is Edward and it's a pleasure meeting you. So your retina is a thin layer of tissue located at the back of the eye. It is arguably the most crucial structure of the human eye. The retina picks up light that enters your eye and converts it to electrical impulses. The electrical impulses are sent to the brain through the optic nerve, and your brain will translate the electrical impulses into real images. This is where our vision comes from. The structure of the retina is, I'm gonna be honest here, extremely complex. It's so complex to the point that it's beyond what most people can conceive. In short, the retina is divided into 10 layers from inside out. Inner limiting membrane, retinal nerve fiber layer, ganglion cell layer, inner platform layer, inner nuclear layer, outer platform layer, outer nuclear layer, outer limiting membrane, rod and cone layer, and last but not least, the retinal pigment epithelium, or the RPE. Below the RPE lies the choroid, a layer of blood vessels that supply the outer retina with oxygen and nutrients. Each layer of the retina has its unique functions and allows us to observe this beautiful world. Normally, the 10 layers of the retina are pressed pretty firmly with each other. However, sometimes due to excessive vitreous traction, retinal degeneration, genetics, or other vascular diseases such as diabetes, the retina can crack open and split into 2 layers. This disorder has 3 forms. Retinoschisis can be acquired, congenital, or secondary. Acquired and congenital retinoschisis are the most common, while secondary retinoschisis is less common. We will discuss acquired and congenital retinoschisis in detail in this video, and we will leave secondary retinoschisis in the future if you're interested. First, we have degenerative or acquired retinoschisis, which describes the splitting of the inner nuclear layer and the outer platform layer. Degenerative retinoschisis develop based on the peripheral microcystoid degeneration. In proximity to the oral serrata, which is a scalloped peripheral termination of the retina, the outer platform layer of the sensory retina shows this little cystoid spaces called blessing cyst. These little cystoid spaces are these grayish white cloudy spots under the retinoscope examination. These cystoid spaces develop due to the poor circulation of the retinal capillaries, causing the cells in the retina to die. The blood supply remains compromised when the neuroglial cells attempt to repair the damage, leading to this microcystoid degeneration. These cystoid spaces slowly enlarge with age and fuse with each other, creating larger cavities between the outer platform layer and the inner nuclear layer. The inner layer of the cavity thins as nerve fibers degenerate and waste away, while the outer layer's photoreceptors and the RPE remains. The cavity continues to enlarge as the disease progresses, while the inner nuclear layer is already separated from the outer platform layer at this stage of the disease. They are still held together by these neuroglial fibers called neuropillars, mainly composed of Muller cells. Due to aging, the vitreous humor degenerate and shrink in volume, which serves as a tractional force on the retina. Usually, this isn't a problem, but in this case, when the 2 layers of the retina are only held together by a bunch of neuropillars, the tractional force will likely rip those pillars apart. A transparent, slimy liquid called mucopolysaccharide acid will fill into the cavity between the inner nuclear and the outer platform layers. This is what we call degenerative retinoschisis. Degenerative retinoschisis mainly occurs around the peripheral retina, usually on the temporal side. I'm actually going to show you a picture of an eye with degenerative retinoschisis. As you can see in this photograph, there is a transparent, smooth, and dome-shaped elevation of the inner layer of the retina. There are also this minute glistening yellow-white surface dots with pitted appearance, similar to a sheet of metal repeatedly beaten by a hammer. These are the traces left behind by the microcystoid degeneration. The retinal vessels also appear darker over the affected area. While retinal schisis may initially sound intimidating, degenerative retinal schisis almost always occurs around the peripheral retina and almost never progresses over the equator. Most patients with degenerative retinal schisis are asymptomatic. In fact, they don't even know that there is something wrong with their eyes, and they only find out incidentally during a routine eye exam. Patients generally have no family history of the disease, and they affect males and females equally. Vision loss is very unlikely because degenerative retinal schisis is relatively static and seldom progresses. In fact, degenerative retinal schisis is much more common than you might think. Overall, it affects over 4% of adults aged 40 years and older. So it's pretty common, right? So yes, be rest assured. If the disease progresses beyond the equator, which is again pretty uncommon, vision can be affected. Patients may notice increased floaters, flashes of light, and reduced visual acuity. Patients can also see absolute scotoma in their vision, an area within the visual field in which perception of light is entirely lost. In rare cases, if breaks occur both on the inner and outer layers of the retina, liquefied vitreous humor can seep into the space between the retina and the RPE, leading to regiment-autogenous retinal detachment. Retinal detachment is the major cause of vision loss in the degenerative retinal schisis patients and not the retinal schisis itself. Now, what are the treatment options for retinal schisis? In most cases, we just watch. Such practice is because the absolute scotoma caused by retinal schisis cannot be restored despite surgical procedures to repair the split retina. Doctors may want to have you back once, maybe every 6 to 12 months to dilate your eyes and check the health of the retina to look for breaks over the affected area. Generally, breaks over the inner layer do not require treatment, while breaks over the outer layer require laser photocoagulation to close out the breaks. If the degenerative retinal schisis is progressive, doctors can create laser burns on the unaffected region of the retina to reinforce the retina, halting the disease progression. In case of retinal detachment, doctors can perform a scleral buckling or a vitrectomy to reattach the retina. Again, this is very rare and only occurs about 0.05% of patients with degenerative retinal schisis, and the disease rarely progresses from where it is first observed. So, no need to worry excessively. As long as you receive regular eye exams, more than likely, you'll be just fine. Next, let's talk about congenital retinal schisis, which is less common but more severe and is more likely to cause vision loss than degenerative retinal schisis. Congenital retinal schisis is also called X-linked juvenile retinal schisis. This is an inherited degenerative disease. The disease is caused by a mutation in the RS1 gene of the X chromosome, which codes for a protein called retinoschisin. This protein is found throughout the retina and is thought to play a role in the retinal cell-to-cell adhesion and retinal architecture. Mutated retinoschisis lead to thinning of the inner limiting membrane, which compromises the retinal architecture. Due to vitreous traction, the retina can split along the nerve fiber layer, leading to retinoschisis. X-linked retinoschisis is pretty rare, with a prevalence of about 15,000 to 30,000. For the gentlemen watching this video, I'm sorry, because this is an X-linked genetic disorder. It almost always happens in males. X-linked retinoschisis develop early in life, usually present in infancy. Unfortunately, the disease is usually spotted at school age due to difficulty at school because young boys with the disorder usually have poor visual acuity, strabismus, and nystagmus. That is the uncontrolled movement of the eye. Upon first presentations, patients generally have a visual acuity between 20/60 to 20/120. Visual acuity may deteriorate slightly during the first and second decade of life, but remains relatively stable until the fifth or sixth decade. Individuals with congenital retinoschisis older than 50 years can develop macular atrophy, which will lead to central vision loss and ultimately legal blindness. Congenital retinoschisis is almost always bilateral, but each eye can have different courses. The schisis usually develop on the inferior temporal side, and just in degenerative retinoschisis, patients with congenital retinoschisis can also present with absolute scotoma in their peripheral vision, which makes congenital retinoschisis so frustrating for patients is that it can affect their abilities to read. Unfortunately, congenital retinoschisis mainly affects the macula, responsible for our sharp central vision. Patients with congenital retinoschisis usually have impaired central vision at birth, which can affect the ability to perform well at school and in other daily activities that other children have no trouble with. So yeah, it's hard both for the patients and their parents. The worst complication of X-linked retinoschisis is that of a retinal detachment. Patients with congenital retinoschisis are at extraordinary risk of developing a retinal detachment in their lifetime, mostly regimentationous, occurring in about 5 to 20% of patients. Doctors will probably recommend this patient have a dilated eye exam once every 6 to 12 months to check for breaks and tears on the retina, especially on the outer layer. If the breaks are found, doctors can use laser therapy to seal off those breaks and prevent retinal detachment. Patients with retinoschisis are also advised against head trauma and high-impact sports to reduce the risk of retinal detachment. Besides retinal detachment, vitreous hemorrhage is also a common complication of congenital retinoschisis. In case of a vitreous hemorrhage, doctors will perform a pars plana vitrectomy to drain the clotted vitreous gel and replace it with another fluid. Vitrectomy should be carried out as soon as possible to restore vision because patients who end up having vitreous hemorrhage are usually young children whose visual sense systems are still developing. Prolonged blurry vision can lead to strabismus and amblyopia. So in short, degenerative retinoschisis develops with age and is usually benign. Most patients will not suffer from any blinding complications, but they need to be followed up regularly to monitor the health of their eyes. Congenital retinoschisis is more malignant and can lead to low visual acuity or even permanent blindness. It is a genetic disorder that predominantly affects males. Patients need to be monitored closely in their lifetime to check for signs of retinal detachment and vitreous hemorrhage. Yes, while congenital retinoschisis is a rare disorder, it can be hard for patients and their loved ones. Children with retinoschisis may benefit from low visioning, such as large print textbooks, handout with high contrast, and sitting in front of the classroom. For parents out there, if your child was diagnosed with retinoschisis, I understand how you might be feeling. I mean, you might feel guilty for yourself for passing down your genes to your children and allowing them to suffer for their lifetime. This is understandable, but I don't want you to feel this way. We all wish ourselves and the people we love to live healthy and a fulfilling life. But unfortunately, it doesn't happen with all of us. All we have to do is to do everything we can, and of course, with no regrets. Alright, thank you for watching everyone. I think this video is probably the most informative video you can ever find online about retinoschisis. If you like this video, don't forget to smash the like button for me, subscribe to this channel, and turn on the notification so you won't miss any of my future videos. Eye health question of the day. Do you know anyone with retinoschisis? How are they doing? Which form of the disease do they have? Leave down your experience in the comment section below because I really want to know. Thank you for watching. Take care of yourself and be well.